staff to resident. There were a couple of times where he went without food, and he called me and said that he was hungry. I followed up immediately and found out that indeed he hadn't been fed. Sometimes it was a matter of him being left in bed while everyone else was taken to meals, sometimes left in bed undressed or half dressed. So those were things that we were dealing with really on a sometimes weekly, sometimes monthly basis. And I think a big part of the problem is the lack of staff. There was just not enough staff to deal properly with every resident in the home.
The stories that are emerging. It's a crisis that is finally, well, it's not bubbling to the surface. It's been on the surface. Finally, people are paying attention. Government officials are now calling the conditions at long-term care homes, quote, deeply disturbing, heartbreaking, totally broken. But one word we shouldn't use is surprising. It is not news to many people. But thanks to this report from the Canadian Armed Forces, who went to help and emerged as whistleblowers, politicians are forced to pay attention. Is this the wake-up call they needed? We all needed. How should the government, provincial and federal, act? We have a special panel to delve into this. Dr. Jane Philpott is the former Liberal health minister who a few months ago began working at a long-term care home in Markham, Ontario due to staff shortages. And Sharleen Stewart is a former frontline hospital worker and the current president of the SEIU Healthcare, which is the union that represents over 60,000 healthcare workers. And they warned the Ontario government about the problems at long-term care homes months before COVID hit. Good to see both of you on the program. Let me start with you, Sharleen. When you guys released a report on this, when the military report came out, were you kind of like, we know this, this is not surprising, this is confirmation, not shock?
Yeah, absolutely, Evan. I mean, first of all, everybody's reaction was like gasping, because it's a very disturbing report. But yeah, I mean, were we surprised? No, because we have been ringing the alarm bells for years, but particularly for the last year with this current government. So it wasn't a surprise, but it was still very disturbing. And I was completely outraged by the fact that, is this the final report that's going to get some action out of this government? Because we've been calling on them for an inquiry, an investigation. They've not agreed to the inquiry, which would completely allow the transparency that we need. And the commission, and even today, the premier said, well, everything's on the table. That table must be overflowing with issues right now. So it wasn't a surprise. What was the surprise is the way that they reacted to it at 1:30 today.
Okay, I'm going to come back to that, but I want to bring in Dr. Philpott. Jane Philpott, good to have you back on the program. When you heard this, you worked there, were you, many people, a lot of politicians like, we're staggered, this has got to stop. Were you kind of like, get serious, we've known this all along?
Well, Evan, if I may begin just by clarifying that I've been helping out at a group home in Markham. It's a home for seriously disabled adults, so it doesn't actually fall into the category of a long-term care facility. That's another whole issue altogether we should talk about another day. But some of the problems that came out in this report are similar to other kinds of care facilities across the country. What I would say on this report is it is absolutely scandalous. I don't think we should paint with a brushstroke, the same brushstroke, every long-term care facility in the country. I know there are some in the country that are well run, where people are getting good care by loving caregivers. But this highlighted 5, and surely there are many more than just 5, but 5 facilities where the care is abhorrent and where people have been trying to raise the alarm bells, where there have been Auditor General reports and all kinds of other people who, like Sharleen and others, who have tried to blow the whistle before. Finally, the military has put out a report which has shaken us to our core, and hopefully this will be the one that will trigger, finally, I believe, a full national inquiry, not just a localized regional look. But this is something that every order of government, every political party, every healthcare administrator in the country needs to take some responsibility for.
calling for a national public inquiry. Sharleen, let me go back to you. You said, talk about what you found last year, and you said, you know, it's not just the Ford government. The Liberal government also lacked inspections in Ontario, and we can go to Quebec or British Columbia. There's lots of other provinces. But what particularly, when your organization released that report, what were you finding in the last year before COVID?
Well, I mean, we could predict that there was going to be a real tsunami. We call it the silver tsunami, right? And we've been talking to governments for years about that. How are we, and I agree with the statement that we all have a responsibility in here, how are we going to prepare for this? We could see it coming. The levels of care were increasing and the staffing was decreasing. The skills of the staff was looking at being much more enhanced than what they were seeing. So we were working with, you know, governments all across the country to try and address these issues. But recently, in the last year, which is so ironic when I watch what the Premier and the ministers are saying, is just last year when we were trying to address the for-profit issue, and there's data now that everybody has seen that points to that being a real problem. But we were saying about the making profits on human beings was causing and affecting levels of care and the service that was in there. Instead of working with us to try and address that, they put a wage cap on these workers and continued to make the work even more precarious. So they lack full-time work, they lack sick paid days, and you want people to stay home sick when they're working in these congregate settings. And of course, the wages, it just added to a crisis that was already evolving. The inspections, we were asking for more inspections and more regulations and oversight on the whole service provided, but instead they cut back the inspections. That was before COVID. I mean, then when COVID came, you couldn't even get inspectors in there, which we had to get order. We had to get the Labor Relations Board to order them to go in there. So it was a pandemic on top of a pandemic, to be honest with you.
So are you just saying, just real quick, are you saying that the very things that, you know, you hear Doug Ford and all the ministers say, we've got to come and fix it, they are in some ways the cause of some of the very things that have caused this situation that now they're promising to fix?
100%. And just before the shutdown, I met with the government on the Whitlofer report. And what was top of orders in that was take a look at the staffing levels. I mean, it's unbelievable what we're asking those workers to do. 3 months ago, they were totally ignored and I say neglected themselves, disrespected, but now they're heroes. And all of a sudden, this provincial government realizes that. Well, an inquiry would point out those things, and I would be more than happy to testify an inquiry about how many conversations I've had with them face to face over this.
Dr. Philpott, let me go back to you, because you've talked about the for-profit model. Is there any evidence that the private long-term care facilities, the so-called for-profit, are better run than the public ones? And do you think it is time to get rid of for-profit long-term care health?
Well, as Sharleen mentioned, there is some evidence, at least in Ontario, that the numbers of deaths, for example, are higher in for-profit facilities. This hasn't necessarily been the case across the country, but it's something we have to take very seriously, and it leads to the kinds of things that Sharleen talked about. The report from the military today described scenarios where there were 200 residents in a long-term care facility with only one nurse caring for them on some shifts. They talked about having personal support workers that were caring for entire wards of over 40 people. And these are people who have extremely high personal care needs. So we see that the for-profit motive can very easily influence an organization to cut back. And the first thing that often gets cut is staffing. And so this is an area that we all do have to look at. And, you know, all Canadians are complicit in this, in that, for example, the money that goes into the Canada Pension Plan Investments, we know, is an owner of dozens of long-term care facilities. So we have to look at what's the right thing to do and get the evidence clearly, and then set national standards, because what has to happen, as Sharleen has pointed this out, is we have some standards set at the provincial level, but they are not being regularly followed through on. There needs to be an accreditation system similar to that we have in hospitals, ensuring that a certain quality of care standard will be met, or there will not be funding, or people will lose their license to be able to run a facility like this.
So you knew this when you were the health minister federally. Why didn't you urge the federal government to do some of this stuff?
Well, I'm a big believer in national standards, and I'm a big believer in the federal government playing a large role in healthcare. As you may know, over the years, there is this narrative that federal governments like to repeat, and that's that healthcare is a provincial matter, and in large part, the delivery of care is provincial. But the very best things that we have done as a country on healthcare, like setting accessibility as a principle, that people will get access to care based on need and not based on the ability to pay, those have all come when the federal government has stepped up to the table and taken responsibility and set those kinds of standards or principles. And I have always believed that the federal government could have a bigger role. Of course, that bigger role has to come with funding attached to it, but here's a perfect example of where setting a national standard could make a huge difference, and it doesn't trample on the jurisdiction of provinces. When there's money there and the federal spending power of the government is willing to step up to the plate, a lot of good can come from it.
Okay, it's a fascinating discussion. We need more of it because it's not just interesting, it's a life and death discussion. Dr. Jane Philpott and Sharleen Stewart, great to have both of you on the program, and I really enjoyed listening to both of you. Thank you.
My pleasure.
Thanks.
Take care.